So this is it, video 3, practice implementation. This is where everything comes together. Hi guys, Mariki here, and I really hope that you've enjoyed this 3-part series so far. This is the last video in this series, and in this video we are going to do the practice implementation side, bringing everything together and giving you tools in how to actually make this make business sense. If you haven't watched the first 2 videos, please go and do that first. I have put the links down below this video. And as always, I've made some resources available for you as well. So be sure to check it out below. Make sure that you download all the free templates that I am making available for you as well. All right. Make sure at the end of this that you actually do incorporate this into your business and go and change some patients' lives, because it really does have an effect on their quality of life. Right. Watch it to the end. Subscribe to my channel to not miss out. And remember the resources below the video. Go and download that for yourself as well. Right. Let's get into it.
Hi guys, Mariki here. I hope you're excited because I'm about to put the final piece into this puzzle. This is the conclusion of our 3-part video series. And in the previous 2 videos, I have given you some of the theory that you need to understand and how to set up a successful dry eye clinic and dry eye practice. And in this video, I'm going to show you how to take that theory and set it up in your business. The first part of this video is going to be about how to set up your systems, paperwork, practice flow in order to make things fit perfectly and smoothly. After all, you cannot afford to lose time sorting out admin and time glitches. Okay, so now we're going to jump into today's training about how to set this up in your business. I will be doing the financial examples in South African Rand, so I apologize to my international friends. All I want you to see is the concept, and then you can go and pull it into your own environment with your own pricing structure and your the relevant coding for your country. Where possible, I will kind of elaborate a little bit more in different currencies, but please don't get stuck on the numbers. It's all about the concept of the numbers so that you can just go and implement this in whichever area you are working in. So the first question I want you guys to ask is, how do I become more efficient with my dry eye patients? This is one of the most common questions I got in terms of when we're talking about dry eye practices. And there's 3 very important key points that falls into this that's going to make your life easier. The first thing is that you need to set up a standard protocol. Protocols are there to make everything work fluently and efficiently, but so that everyone that works in that structure understands what needs to happen next. Everyone's on the same page, which means that things can happen quicker and at a more effective rate. Then the second thing is you need to know how and why to do your dry eye diagnostic procedures. We went through this a little bit in video 2, but diagnostically you cannot fumble. You need to know exactly what comes before what, how you need to do them, and what the actual results mean. Because you can't afford to waste time on actually going and reading up or figuring out how to do this procedure. So you have to get yourself adequately trained in terms of your diagnostic procedures. I have given some resources. I have given the ebook and these lectures that we're doing now. So please go and make sure that your procedures are down and that you do not struggle with those. And then the third thing is that you get your practice team involved to streamline the process. And that is exactly what I want to show you now, how to do that and how to get them involved to save you time and effort and get everyone on the same page. So establishing a flow in a practice can only be done in a system of teamwork. For me, I love team and I cannot do anything without my team. When you can get your team on the same level as you, thinking the same way as you do, it really makes your life a heck of a lot simpler. But more than that, it saves you time that you would have spent on something technical that you should really not be doing yourself. I've been in so many practices, optometric practices, where the optom literally does everything, from their own screenings to their own topos, OCTs, and everything. And this is really a waste of your time. You need to start teaching the people that are around you to do certain things, which they are very much capable of doing. Take yourself out of the technical space and you spend the time on the diagnostic space where your expertise are the most valuable. So in terms of structuring your dry eye system, this is how it will work. Your receptionist will be responsible for receiving the patient and getting the initial paperwork completed. That includes your questionnaire, like your OSDI questionnaire, as well as any other dry eye paperwork that might be related to this patient. Then from there, they will go into the dry eye room, which is a prep room. At this stage, the procedure that you have decided that would happen will be explained to them, and whatever pre-prep that is necessary, like anesthesia or a heat mask or something like that needs to be done before you can actually do a procedure, that gets done at this point. Now, I have educated and trained my practice assistant, my clinical assistant, to actually do this section for me. So she will receive the patient from reception, take them to the dry eye room, get them comfortable, explain the procedure to them, have them sign patient consent forms if that is necessary, put an anesthetic and put heat masks on, and whatever it is that needs to get done before they can then come into my office for the actual treatment that is going to get done. At this stage, it all depends on what it is that you've decided to do for this patient, and this time spent in the dry eye room could be longer or shorter depending on what it is that you're actually doing. But again, the focus here is the fact that you do not have to do this. You do not have to go through this process with the patient. You can have your team actually take over portions of that. So once your assistant is finished with the patient and the patient is ready, then they will be brought into your consulting room, at which point you will perform the procedure. Here you don't have to explain it again because they've already had it explained to them. So you literally sit the patient down and then perform whatever procedure it is that they are there for. Here you can spend a little bit of time though talking to the patient about their home care, their home prescription, whatever drops you are giving them, whatever home care you're giving them. That is something that you want to go through in detail, making sure that they understand what it is that they need to do at home. Once they're finished in your office, they will return back to the reception room where the receptionist again will take over and hand them whatever it is that they need to take home with them. So if you have prescribed and you will put it on a piece of paper for your reception, you will say to the receptionist that the patient needs, say, a lubricant eye drop and a warm mask for home care. The receptionist will then compile that into a nice little goodie bag with the patient pamphlet so that they can read it at home and make sure again with the patient that they understand what it is that they need to do before the patient will then leave your office. A good flow and a good efficiency really builds an incredible relationship with your patient. When the patient has this experience of a practice that really has got everything working well, then the patient's trust level goes up and they are very likely to return to you for future treatments and also do what it is that you asked of them to do at home. Timing of the teamwork is essential, so the team needs to understand how they fit in with each other and they need to not miss their cues, because otherwise patients can sit for a long period of time and then it becomes a little bit of a problem. All right, so that is the flow in terms of practice. Guys, this is really important that you actually start utilizing your team. And I've just said it before, but I just want to say it again. You guys, please use the people around you. We are wasting so much time doing things that can really be managed by someone else. Now, the big question, what is this going to cost me? And I think other than the efficiency question, this one probably got the most ratings. Most of you either want to know how to implement this in your businesses or think that it's going to cost you a huge amount of money. So I want to quickly break down the costing for you in terms of what your basic equipment needs will be to manage dry eye effectively and what that is going to cost you, but then also how you would cost this out to the patient, right? So if we talk about a dry eye clinic, there are a few options. It's going to be either aqueous deficient dry eye management or evaporative dry eye management. The aqueous deficient side, most of the time, is going to be managed with punctal plugs. And we'll get to that just now. It's not included here. It's a little bit later on, but we'll get to that. What I want to focus on here quickly is your evaporative management, because at the end of the day, that is going to be 80% of your group that needs treatment is going to be evaporative. So I want to focus on that quickly first. What do you need to accurately manage an evaporative dry eye patient in your office? Okay, so these are your startup costs, and this is really the basics that I think you would need to do this. We are not talking about extra expensive equipment. I'm not talking about topographers and slit lamps. That is something that you can get. Obviously, I love being able to manage my patient with a topographer and a digital slit lamp. But if you don't have those right now, you can probably get by without it. You need to have a slit lamp, obviously. You don't have to have a digital one, although taking photographs really makes a difference in terms of your trust component with your patient. But you really don't have to start up spending those huge amount of monies on equipment. That you can do at a later stage when this starts to actually generate enough of an income to cover that equipment expense. But the basic treatment equipment that you're going to need is the Blepharostem. Now, a Blepharostem is a heat mask that is plugged in. And what a plug-in mask does is it retains the same temperature of heat for an estimated period of time. The Blepharostem stays on for 10 minutes, which is efficient to actually heat up the lids and the glands for a lid treatment then after that. Then the second tool you need is a Kopecky debrider. Now, a debrider is something that you use to actually remove all the extra dead epithelial cells and biofilm on the edge of the lid margin. You can use a normal metal spat like I show you there on the right side of the picture. The problem with the metal spat is that the tip is quite small and you might slip into the lid. The debrider really works well because it has a long point and it really is a lot less uncomfortable for the patient. Then the third thing you will need is a paddle tweezer. Paddle tweezer is there to squeeze the lid in order to get the meibum to express out of the gland. There are many different types of this type of tweezer. You will have to see what you can find in your environment. But this one, the Collins tweezer, is the one that I use. I found it incredibly effective and it really works well for the process that we will be using it for. Then the other two startup cost things that I've listed there is your lissamine strips and your fluorescein strips. This should be something that is part of your general practice anyway. I just included it there for sake of completion, but this actually should not be part of your startup cost because it's already part of your normal comprehensive exam. So if we look at those costs, it comes to about 12 or 13,000 if I round it off, 13,000 Rand to set up these basic treatment equipment that you would need for evaporative management. Then let's have a look at what punctal plugs is going to cost you. Again, if you are in another country, please don't look at the numbers. You are going to have to look at what you can find and what your suppliers will charge you for these things. But I'm trying to give you a comparison between the cost to practice and the income to practice, just to kind of give you perspective on income versus expenditure. Okay, so in terms of punctal plugs, you get collagen plugs and you get silicone plugs. Collagen are temporary plugs and silicones are more long-term plugs. So collagens comes in packs of 10 and you're going to look at about 800 Rand to practice for 10 pairs of collagen plugs. With silicone plugs, they're going to be more expensive. They're about 3,000 Rand per pair. This is preloaded plugs, so they can be a little bit cheaper if you go for mass amounts where you just buy the plugs separately and the inserter separately. So there are cheaper options, but this is kind of what I normally go with. Okay, and again, like I said to you at the bottom, please, the prices vary depending on brands. This is just an estimation to give you an idea of cost versus income. Right, so that's what your cost would be for your aqueous deficient treatment if you're going to actually give someone a punctal plug. Now, the million-dollar question, why do I charge for the workup? So remember what I said about the workup. This is a process that you do to actually determine the classification. So this is done before treatment. Once you finish your comprehensive exam, you take the patient into a workup. So whether the patient is aqueous deficient or evaporative, this applies to all patients because you want to make a definite diagnosis. So every patient that's a dry eye suspect will be going through this process. Now, how does that work? In our coding structure, these are the codes that I found the most relevant. We are busy working on new codes and new structures, but for now, these are good. And this is the prices that I charge. So the 4 things that are involved in a workup would be your topography, your ocular pathology screening, which includes your stainings and your slit lamp evaluations. Then your lacrimal system evaluation is things like your Schirmer tests and all of the tear drainage tests that you might do. And then anterior segment photography, if you have a digital slit lamp and you're actually doing photos, then you can charge that as well. So cost to patient, a dry eye workup, a complete dry eye workup will cost the patient about 1,000 Rand. Now, if you go back to the first video, you will see I worked on this 1,000 Rand, and this is how I actually structured it. Per patient in a workup, they will be charged 1,000 Rand to work through the whole workup. And in terms of comparative between a normal consult and a workup, you're looking at the workup charge being about double the normal consult fee. So if you're somewhere else in the world, if your consult is, for instance, $200, then you could easily double that up to charge your workup a double amount of fee compared to your normal consult. Right, now this is where this gets really great and very fun. If you had a look at your expenses and what your setup expenses was going to cost you, plugs excluded, we're just talking about the actual equipment expense, then all you will need is 13 patients to complete your dry eye workup in order to cover all of your initial equipment expenses. That would mean that if you have done 13 patients through a workup, your expenses have been paid for. Everything after that is profit. And guys, I mean, 13 patients, let's be honest, 13 patients are not a lot. You can do 13 patients really easily. We spoke about doing 2 patients per day. So you could do this halfway through a month. And then everything else you do after that, you've pretty much paid all of your expenses. Right. Now, in terms of how do we charge for the treatment side of it, if you look at the first block there, it says closure with lacrimal punctal plugs. So you would charge about $550 for a patient when you're doing plugs. This is mainly for collagen plugs. Silicone plugs are more expensive. Silicone plugs, you can charge up to about 6,000 Rand for 2 silicone plugs. But this is the standard rate and standard medical aid rate for punctal plugs. And then what do you charge for your treatments in terms of your dry eye clinic? If you have a patient coming in for evaporative treatment, lid management, then you would actually charge a 15-minute consult, which is on our side 250 Rand, and you would do a minimum of 4 treatment sessions with them for an evaporative situation, which will then be another 1,000. Again, this 15-minute consult in perspective is now about half of a general consult. So where your workup is about double the normal consult fee, your actual treatment session in terms of your dry eye clinic per treatment is about half of a comprehensive exam. So I just wanted to put that in perspective if you're anywhere else in the world, to take whatever fees it is that you're charging and kind of work it out in perspective to this. Obviously, the fees will probably vary greatly, so will the coding and everything, but just to get a perspective on how much you need to charge for this to be actually financially feasible. And guys, that is really how simple this is. If you have a patient in your office, you're doing a general consult, and you think that they might be a dry eye suspect, you put them through a dry eye workup that you can charge 1,000 Rand for, and then you find that they have evaporative dry eye problems, and you book them in for a lid management, a 4-session lid management. That's another 1,000 Rand. So you can literally make 2,000 Rand per patient in terms of this whole dry eye system. And it's really as simple as it looks. It's just going and figuring out how this is going to work in your practice and how you can actually implement it, which depending on region and country might be a little bit different than what I just showed you. But you can really work off these numbers and it'll be more than effective and more than efficient for your business. Right, so just to do a quick recap again, I don't want to lose you guys. There's so much information I'm trying to cram in these videos. So in the first video, I showed you how to screen for your dry eye patients by doing further tests as part of your comprehensive exam. In the second video, I showed you how to accurately diagnose your dry eye patients, which allow you to treat more effectively and also generate trust with your patients as well. And you will also gain this trust from the other medical professionals who will come to hear of the great work that you are doing. And in this video, I showed you how to set it all up in your practice, and then also how to bill for it. In this masterclass, I'm going to take you through all the ins and outs of dry eye, all the theoretical as well as the practical knowledge. And this is really going to allow me to hold your hand, walk this road with you, and get you started and get you building your dry eye practice into an exceptional next level specialty practice. So this brings us to the end of the third part of this training series. I really hope this has added a huge amount of value to your life and to your business. I want to challenge you to go and take this information and actually go and implement it into your business. And if you are willing to take the next step and walk this road with me and let me hold your hand and give you all of the information that you are going to need, as well as all of the templates that I have available, then watch out for the email about the Dry Eye Masterclass and sign up for that. That is really going to be so worth your time and worth your effort. And I really want to hold your hand and take your business into the next era, into this next level of specialty practice. And like I said, I really hope you enjoyed this 3-part series, and I trust that I will see you again in the next program.
Very, very important that you actually take the time to do that. My voice is sounding a little bit funny. Okay. So that we can actually, but every individual's business, so please remember, if you